Dan, you're working from home today, but a few days ago you had to go through a somewhat intense process of seeking some medical assistance over COVID-19 scare. We are so glad you are okay. Dan, how was that?
Thank you very much, Lois. Beautiful thing. First, it was bad, at least in as far as my body felt. I don't know if you've ever had or know of someone who's had what they call the man flu. I have had it a number of times, and this time around it got worse since the coronavirus season. I got sick, had to get a COVID-19 test done, and between the test and the results, well, you can find out as I walk you through my journey.
So on the last week of March, I caught a cold. That's what we believed it was. I actually got it from our 2.5-year-old daughter. She got better and she left me there wallowing in the discomfort of sickness. It got bad. I was still going to work. Eventually my voice started getting hoarse. I started having a bit of a runny nose. I had a rare cough. It was not dry though. Then there's a night I believe I slept badly, so my back was in pain. It got worse when I was still working. I remember on the 1st of April Fool's Day, but mine was full of drama, I guess. And I decided, you know what, I'm going straight to hospital. It felt even harder because the roads are so empty at that hour. So you could almost hear the echoes of silence. They did some tests and something had taken a hit on my immunity. And so the doctor then said that he asked me of my travel. On 17th of February 2020, my colleague Eric Okoth and I left for New York. Our flight was going through Paris. So in retrospect, you see how significant these 2 points were. We're back in Nairobi again through Paris on the 23rd of February. So we got to JKIA and there was the testing that was done, you know, just using a temperature gun. That was all. Then we went home. They said my travel was still a bit far back. So he said, you know what, it would just be safe to just go and have a COVID-19 test done based on some of the symptoms, just to be sure. I went to Kenyatta National Hospital, the Mbagathi branch, that is the infectious diseases unit. Told me that they do not do tests at night, and either way they don't even have the capacity to accommodate extra people in their facility at the time. So they politely asked me to just go home and go back in the morning. So for me this was a bit of a red flag, because I'm like, what if I was actually positive? You don't know how I am getting home. Will I be disciplined enough to stay in isolation since I'm already unwell? I was in a very bad state. I was fatigued, I was tired, I was drained. By God's grace I made it, you know. The next day we dressed up and left for KNH Mbagathi. I was more nervous about that thing going into my nose than anything, than even the results, to be honest. And so I moved into the children's room for isolation while still taking my medication.
This is my first morning of isolation. This is the day that, like I said, I am expecting my COVID-19 test results. Yes, Bella?
It was hard. I can't have contact with my 3 girls, my wife and our daughters. It was difficult. When it came to prayer time in the evening, our usual evening devotion as family, I mean, I'm just in the house, but we're still doing it on Zoom.
Yeah? Yes, Bella? Not now, Mama. I'm yet to, play the music I want to plug in, because I'm listening to my wife and my daughters as they prepare to go to bed. That's the closest I can really get to bond with them for now. On Friday, we are told that our test results will only be out possibly by Monday. It's a bit of a slightly heavy day. I'm like stuck in these walls. Knowing that my family needs me and I can't really be there for them as I should.
Our results were out Monday evening. We got them on Tuesday, and we were both negative. And I was feeling better by then. The man flu hit me hard, gotta be honest. I was in isolation for 4 to 5 days, and I'm fortunate enough to have the privilege of being able to stay home and not go to work. I thought about those people who may have been infected and did not have the chance, or they don't have the luxury to rest. They probably went about their business. 4 to 5 days, that is a loophole, if you ask me, for the community infection to happen. These guys said they didn't have the capacity to keep me there until my results are out. So how many people probably have gone and have been asked to go and isolate and may not have either the discipline or the luxury to take care? Loophole, in my view.